This is the endovascular embolization of a ruptured posterior inferior cerebellar artery aneurysm associated with a cerebellar arteriovenous malformation. The patient is a 72-year-old female with past medical history of hypertension. She presented with the worst headache of her life after falling. She started to have slurred speech and altered mental status and had to be intubated. CT scan demonstrated intraventricular hemorrhage, and CTA demonstrated tortuous vessels in the midline, probably related to an arteriovenous malformation. Patient was taken emergently for a posterior fossa decompression, craniectomy, and evacuation of hematoma. This is the CT scan demonstrated a large intraventricular hematoma from the foreventricle into the lateral ventricles, causing hydrocephalus and severe intracranial pressure. CT angiography demonstrated a intracranial aneurysm associated with a arteriovenous malformation. Once the patient was stable and the intracranial pressure under control after surgery, patient was taken to angio suite. A 6 French catheter is then placed in the left vertebral artery. Angiogram demonstrating the large arteriovenous malformation and the aneurysms associated with it at the proximal portion of the pica on the left side. The decision now is to embolize the aneurysm, which is probably the likely cause of the intraventricular hemorrhage. Here we're navigating a microwire and a microcatheter through the pica artery into the aneurysm. Careful maneuvers of the microwire passing the aneurysm distal to have a better support for the microcatheter. The microcatheter is then navigated and approximated into the aneurysm, and the wire is removed, moving forward the microcatheter for positioning of the tip of the microcatheter. Then the catheter is primed with DMSO, and onyx is then injected slowly. Here you can see how the onyx is navigating through the microcatheter. Onyx is then slowly coming out of the microcatheter into the aneurysm and into the distal portion of that pica artery. Continue with embolization. There is some reflux back into the artery. Immediate angiogram demonstrate that the aneurysm is completely embolized, and so is the distal portion of the pica. This might result in a small stroke of the pica distribution. Once it's all embolized, the microcatheter is then removed carefully. Sometimes the microcatheter can get stuck with the onyx embolization. In this case, the microcatheter came out easily. Angiography demonstrated well embolization of the aneurysm, and angiography of the vertebral artery demonstrating no complications.